Understanding the risks associated with spinal surgery are some things that to consider. Now, and of course, every case is different, so therefore you would have to have your own risks analyzed by any surgeon that you choose, but there are a couple things that we need to understand. Number one is spinal fusion is something that fuses the spine, so one risk is significant loss of mobility or motion within the spinal column. Because spinal fusion is a non-functional approach that fuses the spine, the biggest risk is loss of function. Number two is because the spine screws are installed into the spine, the second risk is hardware failure. The spine, the hardware could fail, it could pull out, it could be damaged, it could have maybe need to be replaced or revised throughout somebody's life. So therefore there'd be hardware failure and replacement, so multiple surgeries. Also, in addition, is there could be infection or allergic reaction to the rods and screws, which is another significant side effect that can happen as a result of scoliosis surgery. And last thing is the lack of understanding of what could happen post-scoliosis surgery. So if patients continue to worsen or things get worse or people have spinal pain or spinal issues, their treatment options now are much more limited because they have rods and screws in their spine. So therefore conservative treatment now becomes a less option. Doesn't mean I haven't treated patients with spinal fusion, there's just much less that we can do. So therefore anything that complicates the situation later on, the options are much more limited.